Whether you're praying for a baby or petrified that you might have made one, there are plenty of early signs to watch for.
It is almost impossible to know for certain if you are pregnant until you take a pregnancy test. But a pregnancy test won't provide accurate results if you take it too soon. That's because a pregnancy test measures urine levels of human chorionic gonadotropin, or HCG, a hormone produced by the placenta during pregnancy. And because levels of HCG are usually too minute to measure immediately after conception, a false negative result is possible at this point. In fact, a home pregnancy test will not provide reliable results until, at the absolute soonest, about 4 days before your next period is due. The later you take the test, the less likely a false negative becomes. Although you may need to wait a couple of weeks before taking a pregnancy test, that doesn't mean that there aren't other signs of pregnancy to look for in the meantime. While not every pregnant woman experiences symptoms during their first month, most do notice some changes, even before their first missed period. For example, as early as 2 days after you conceive, your breasts may suddenly feel extremely swollen and tender to the touch. Wait another 5 to 10 days, and you may notice a light to medium pink discharge on your underwear. This is called implantation bleeding, and occurs when the fertilized egg burrows into your uterine wall. In the following weeks, many women notice other symptoms, including fatigue, bloating, and an ever-increasing need to urinate. Morning sickness, which hits 80% of women eventually, can also strike an unlucky few in their first several weeks of pregnancy. If you're pregnant, the second week after conception may also bring another change to your breasts, a darkening of your nipples' areolas. And of course, if your period is late, that's a clear sign that you may be pregnant. No matter what the symptoms might suggest, the only way to know for sure is to take a pregnancy test. If you do get a positive reading, it's 99% likely that you are indeed expecting and should visit your OBGYN as soon as possible. Your physician can do a blood test, urine analysis, or even an early ultrasound to confirm your pregnancy.